I can start on that, and then Dr. Drenzer can add her thoughts. Um, so for advanced ROP that has come to that has arrived at stage 5, and at the moment there are not therapies beyond that are available. There are some techniques for alternative approaches to restore vision-like perception, which we addressed in another question, and a number of other research initiatives sort of along those lines. But really, to date, the short answer is, unfortunately, no, not. We commonly field the question about whole eye transplants because it sounds like a logical thing to do, and we live in an amazing, technological age. The first successful, or the most successful human transplant is the cornea. So it is an ocular transplant. And so it's kind of logical to jump from that to whole eyes from sort of a notion or an idea of it kind of perspective. But in fact, the eye is extraordinarily complex, and successful ocular whole eye transplantation is a real challenge on a vascular level. The blood supply to the eye the vessels are very, very, very fine. So maintaining blood supply to the whole eye would be a challenge. The immunology or rejection of whole eye transplant is also a significant barrier. And remember that the nerves from the retina really go all the way, fairly far back into the brain before they actually connect. So, and you're interrupting that connection. So restoring that connection just from a wiring, perspective, to make it conceptually simple, is also a very daunting challenge. So it really sounds appealing, right? You have a bad eye, why not just give you a new one? It's still more, not more, it is definitely more of a Star Trek consideration, a science fiction consideration than it is a reality at the moment.
I'll just add exactly to the theme that you're saying. The way that I explain it to people is it's the same as having a severed spine. We haven't been able to fix serious severed spine injuries, despite all of the research that's been going into that for decades. And this is essentially a very small spine going from your eye to the brain. And the reason is that your retina essentially is an extension of your brain. So just like we can't do brain transplants, we can't fix transected spines, we can't transect the cable that is the optic nerve and reconnect the two parts of the brain back to each other. And I don't think personally that an eye transplant is really ever going to be meaningfully pursued because of all the caveats and complications and complexities that Dr. Capone was talking about. I think that these alternative visual interventions are going to be much more meaningful as and like anything, the more positive feedback we get in that area of research, the more research dollars go into that area as well. So once we get a little bit of positive results, we're going to see more and more people interested in really making that something that's a meaningful therapy.
Yeah, I agree. I think Dr. Drenzer, sort of phrased it in terms of the clearest way to think about it. The retina is brain. And so I think many of you may be aware that brain transplantation is not, there's a lot of research going on for cellular transplantation and keeping cells alive and getting them to connect and so forth, but it's work that's in its infancy. And until we can talk about transplanting pieces of brain material, we're not going to be really talking about, even beginning to talk about ocular transplantation. And really the only brain cells that have been sort of meaningfully transplanted don't really have kind of nerve connection function. They're just cells that basically exude hormones in the eye, like the sort of thing that you may have heard about for Parkinson's disease. And that's really the extent of it. And those cells, that's a very primitive function a low-level function to just kind of release something into the environment. There's no nerve connection thing that happens there, and really all of vision is about nerve connection. So I think it's I talk to folks who ask questions about future technologies in terms of like short to intermediate term, or long term, and I think this is a long-term play. Yeah, so when folks agree to donate their organs, amongst the organs that are donated are the eyes, and so a common question is, what happens with the eye tissue that's donated, and I think some folks fancy that there may be research is done on whole eye transplantation, and that's actually not the reality, and but the reality is that some of that tissue is used for therapy. So, for example, parts of the cornea in particular are used for treatment, as well as the sclera, which is the white of the eye, is also preserved and used for treatment. Many of the other elements, in cellular elements in the eye, the blood vessels, cells in the retina, so on, have research applications, and so those cells are preserved or harvested, if you will, and then provided to researchers, throughout the country and really throughout the world, to conduct research on both therapies, and in the interest of figuring out ways to preserve the tissue and maintain tissue function. Dr. Drenzer, anything to add?
Not really. I think that covers pretty much everything about when you donate, what to expect.